Okay, well, great. Just wanted to say hello, everyone. We're so happy to have you with us today. My name is Scott Kelly, the Talk to Hear You Partner Outreach Lead. Today, we're discussing the sober truth on preventing underage drinking report to Congress. We're joined by Dr. Alicia Sparks and Isabel Wensley from the Stop Act Report to Congress team, who will discuss a topic that is incredibly important for the prevention field. They'll offer a broad overview of what this looks like and provide tools and resources that can help you in your community efforts. Now, before we get started, I want to note that we'll be recording this meeting. If you have any questions at any point, please add them to the Q&A box located at the bottom of your screen, or feel free to type them in the chat. And with that, I'd like to introduce Rob Vincent from the Substance Abuse and Mental Health Administration. Rob?
Hey, Rob, you're on mute.
Yep.
All right. Looks like I got given back controls. Looks like something changed there. All right. Well, welcome, everybody. My name is Rob Benson. I'm the Associate Administrator for Alcohol Prevention and Treatment Policy here at SAMHSA, the Center of Substance Abuse Prevention. I'd like to say thank you for joining us today for this community engagement session, especially with our leads within the STOP Act and the reports to Congress. One of the things that we certainly hope to achieve here is greater use of the reports to Congress, but more importantly, really to assist you in helping to conduct planning and see how you can use not only the campaign, but use the other materials associated with really a large body of specialists and scientists, legal attorneys, researchers, communications professionals, really to further your goals in the local community. So I'd like to say thank you to the team, Dr. Sparks and her incredible team, as well as our communications team, Scott and others, Chelsea, for all of the incredible work. And with that, Dr. Sparks, I'd like to turn it over to you and lead the band for a while.
Great. Thanks so much, Rob, and welcome everyone. Just want to say thanks to the Talk They Hear You team for having us today. You know, we work really closely with the team, and it's great to be able to show you all the pretty wide selection of products and materials and resources that we have for you as folks who are interested in doing this underage prevention work. So we're really excited to talk to you today and give you a quick rundown of what it is that we do as part of the Stop Act Report to Congress. So my name is Alicia Sparks, as was mentioned. I am the project director of this, so I oversee the many different activities that we do. And I'm joined today by my colleague, Isabel Wensley, who will briefly introduce herself.
Hi, everyone. Thank you, Alicia. And I work with Alicia as a research associate on this contract, and it's really exciting to be here today.
Great. So before we dive in, I've been keeping an eye on the chat to see where folks are from, which is always great, but I don't do math very well in my head. So we have a quick poll for you just so that we can see where you're from and kind of put it in context within a regional setting. So you should have just seen a poll pop up. Hopefully you know the delineations of these. If you have questions, just let us know and I can try to determine what region you're in. But this just helps us give a sense of, you know, who's in the room today and where y'all are coming from. We'll just give this another minute or two. All right, so we're looking at a pretty even split between, or the two regions most represented right now are the Northeast and the Midwest. And I have to say, from a consumption patterns perspective, that's excellent because your two regions have the highest patterns of underage drinking. So really glad you're here. Really glad that you're invested in this work. We also see an uptick in the Southeast. I will say there's something going on in the Southeast where I've seen more prevention work coming out of the Southeast in the past 2 or 3 years than I've seen in the past 10. So it's really exciting to have kind of this movement out of that region. Great Lakes, Northwest, Southwest, and a few coming to us from the Pacific West. I'm in California, so nice to see you all Pacificers. All right, great. Thanks, everyone. All right, let's go ahead and dive in. So I just want to give you a very quick background on the Stop Act because, you know, I think that's a term folks hear out there. You hear about the Stop Act grants, perhaps, or, you know, this kind of vague notion of the Stop Act. And so I want to give a little bit of detail of what it is. And I think it's important to note that it's actually the sober truth on preventing underage drinking, STOP, which is much more convenient to say, which was enacted in 2006. And so you're going to see a slide when Isabel presents that shows sort of where the STOP Act came into place with some of our major policy and how the consumption has changed. And so since the STOP Act has been implemented and enacted, we really have seen a concentrated effort to prevent and reduce underage drinking at the federal level. And we'll talk about the agencies who are involved in that in just a moment. This is a small kind of nuanced thing, but it's worth noting that this is actually codified in US law, the STOP Act is, which means that we are on the books. This is a piece of legislation that is, going to live on in that books. And again, that just really shows the commitment to this work from a federal perspective. The STOP Act established the, here we go, Interagency Coordinating Committee on the Prevention of Underage Drinking, which is very fondly referred to as ICPUD, if you've ever heard that term. And the ICPUD is the federal body that is responsible for putting together a plan to prevent and reduce federal underage drinking at the federal level. And what I love about the ICPUD, besides its name, is that it is made up of over 20 different federal agencies who are all committed to this cause. And you can see those agencies here. And some of them, are ones you might expect. SAMHSA, of course, CDC, the National Institute on Drug Abuse, the National Institute on Alcohol Abuse and Alcoholism. But then you also see that there are a number of other agencies here who are really invested in this. The U.S. Department of Treasury, U.S. Department of Transportation, you think about things like motor vehicle crashes. Office of the Surgeon General, of course, the U.S. Department of Defense, so those who are working with military service members or their families. So again, we won't go through all of these, but you can just see the wide gamut of federal agencies that are invested in and supporting this effort as part of the ICPUD. There are three main pillars of the STOP Act. These are not in order, so I'm going to say first, but that does not mean that they are more important than any of the others. But the first is the ICPUD and then the annual reports, which is what we're going to talk about today and go through those. The second is the Talk They Hear You national media campaign, which you all are very aware of and who are hosting this excellent webinar for us today. And then the third is the community-based coalition enhancement grants. And perhaps some or many of you may have received those grants or been part of a community that has those grants. And the goal there is really to move community coalitions into action as it relates to underage drinking. So those are the three tenets of the STOP Act, and they really all work closely together to create this landscape of prevention and reduction of underage drinking. So, we try to get as many resources as we can out to the campaign, which then also puts them directly into the hands of the community coalitions. And so we're really looking at this symbiotic relationship between these three to provide as much support for the folks on the ground doing the work as possible.
And really, why are we so dedicated to working on alcohol? We have those 20 agencies. All of you are here today and are probably very familiar with this space. We'd really like to kick off this portion of the presentation, really grounding ourselves in some of the fast facts on alcohol. So we know over the past 2 decades that we've made incredible progress in reducing and preventing underage drinking. And this is truly because of the collaboration, not only at the federal level, but also the work that all of you are doing in your own communities. So past 2 decades, about a 15% decline. And again, that's definitely something that should be celebrated, but it should also act as a motivator to remind us of why we're doing this work and how important it is to continue to decrease this number. Because 40% is still far too high. And this 40% also represents some of these larger statistics as well. So we still know today that alcohol is the #1 most used substance among youth. Again, that's more than vaping and nicotine products. That's more than marijuana and cannabis products. So again, #1 most used substance by youth. And also, as prevention specialists, we're all very familiar with why we are so dedicated to prolonging, starting, or initiating alcohol use. And right now, 15% of youth started drinking before the age of 13. And we know that this is a very risky number because that can lead to an increase of problems later on with alcohol, including alcohol use disorder. And another reason why we're all gathered here today is because alcohol has incredible impact on our communities. And in terms of deaths, there are 100,000 alcohol attributable deaths in the US alone per year. To put that in perspective, that's about 3 sold out Taylor Swift concerts. For those of you out there who enjoy that music, that's about 5,500 full classrooms in the US, and that's about 1,700 full airplanes. So put that in perspective. That's a huge number of people per year who are dying. And of course, death is not the only reason why we care. There's also the economic burden. So in the US alone, the economic burden is roughly $353 billion. That is a ton of money. And alcohol also affects people other than the drinker. So we all are very familiar with the harms associated with alcohol in terms of individual consumption, but often we don't think about the people around those who are consuming alcohol excessively. We see increases in child neglect and maltreatment, increases in physical, sexual, and psychological violence, and truly it affects everyone in the community, families, teachers, classrooms, all of that. And we know that alcohol consumption does not affect populations equally either. So there's huge inequities when it comes to alcohol-related harms and consumption. So a few prime examples of the inequities we are seeing today, and unfortunately, we don't have enough time to really dive into the history of why we are seeing all of these inequities, but to really highlight some of these differences, first, we have the alcohol harm paradox, which essentially is that those of lower socioeconomic status, those with lower income, experience far greater harms despite consuming less. And then we have in Black and communities of color, we see more alcohol outlets in those communities, which is a community risk factor. We also see advertising, alcohol advertising that's targeting historically oppressed populations, including people of color and LGBTQ communities. And finally, women also experience far greater alcohol-related harms, again, despite drinking less than men. And that's both the direct harms of individual consumption, but also the harms to others as well that we were just talking about. And again, we don't have time to dive into the historical context of why this is happening, but we can think about today some of those reasons why we're seeing that inequity as community risk factors. So differences in these community risk factors can lead to inequities. And when it comes to alcohol-specific community risk factors, they're kindly referred to as the 4 Ps, and that's a good summary of them. So we're thinking product, place, price, and promotion. So when there are differences in where alcohol outlets are placed or the price of those beverages that are being sold, that's part of the reason why we see some of these inequities. We're going to go through a few quick examples to hopefully make this really nebulous content make a little more sense. So first, product. Historically, research has continuously shown that these Alco Pops or really sweet malt beverages such as Four Loko, Twisted Tea, Mike's Harder margaritas, all of those were placed in communities who, again, were historically oppressed. So where unemployment was higher, where you have larger and greater proportions of African American community members. And that's not just happening in the past, of course. These products are still coming out and hitting the shelves in very different ways and impacting communities very differently. And so I'd love to know in the chat, we have some photos on the screen of things like Eggo Sippin' Cream, Hard Sunny D, Hard Mountain Dew. If you've seen any products in your community that have come out that are newer or problematic, feel free to put those in the chat. We'd love to know what you are seeing on the ground in your communities. But again, with these newer products, we're already starting to see different patterns of where these products are showing up. And again, that leads to that inequity component. And I see Brooke put in White Claw. Yes, they have the White Claw vodka. They have a ton of different varieties that come out throughout the year, different packaging. The Sonic Seltzer is another great example. And then, of course, we're also thinking about the promotion of these products within the community. Now, either close your eyes or think about your community for a second and think about if you've seen an alcohol advertisement in your community over the past few days, or maybe it was a billboard, or maybe it was something that you saw in a newspaper advertisement. Those are all pieces of promotion for alcohol. And historically, we've seen that alcohol advertisements have targeted those who are from lower income backgrounds or people of color. Again, these historically oppressed communities are being targeted even in modern advertisements. So LGBTQ groups, Latinx groups, all of these. And let's see, anything in the chat? And again, if you've seen any type of advertisement that you want to call out, feel free to put it in the chat as well. And so what is the solution to all of this? I think we can definitely agree just from that very brief summary and from all of the experience that you have had that this is an incredibly pervasive problem within our communities. So what is the solution? And there are so many things that you are already probably doing within your community, but one really effective solution is policy. So again, if you are working on policy in your community, feel free to put it in the chat. We'd love to know if you've ever worked on policy, or if you're interested in learning what policy is, put that right in the chat. And so when we're thinking about policy, we're really thinking about laws, city ordinances, or even practices that institutions are implementing. So think bylaws or policies within organizations like law enforcement or businesses. And these policies are impacting the environment, and they're attempting to regulate or impact a number of different things like availability or sale or price, all with the goal of changing the environment to increase health outcomes, to have a positive impact on the community through these changes. And we can really think about alcohol policy as, again, being one of those really high impact solutions when it comes to impacting health outcomes. So here we're looking at a triangle. You'll see on the right-hand side, it says largest impact to smallest impact. And then political will is on the left-hand side. And that blue bar is really where alcohol policy lies. It has true impact because it is affecting usually an entire population at one time. It is creating change by attempting to change the status quo or people's behavior, again, by altering the environment in which that behavior is occurring. And so another way we can really think about this is the difference between working upstream and working downstream. And I'm seeing Roxanne said, we passed social host policy in our county. That is absolutely fantastic. Congrats, huge win for your community. And here we can really see a visual demonstration of upstream and downstream. So when we're working upstream, think there's something floating in the river, and if you're able to catch it early enough, you're preventing it from making that entire journey down. So you're impacting it at the start. And those would be really large policies like regulating the physical availability or taxation. And then as you work down, you get to more individual strategies like education or persuasive strategies. And now we'd love to hear from you again in the chat or in the Q&A, where you are working within upstream and downstream. And so those that are working upstream are more likely to, again, have greater impact on reducing and preventing underage drinking. And what happens when we're working upstream or when we're working on these policy solutions? Well, we know from lots of research that when we're decreasing the availability and affordability of alcohol, it is associated with a ton of really positive outcomes like reducing violence, reducing disease incidence, and also overall decreasing overall consumption and excessive drinking. And policies can look like a lot of different things. So we have more public policies and then institutional policies. So public policies would be some of these more upstream pieces that we're talking about. And these public policies are laws and ordinances. So the decision maker is some sort of legislative body, whether that's town council, city council, county council, or even the state legislature, or you could even think of it at the federal level with the federal government. And then there are institutional policies. So with institutional policies, we're thinking of trying to change a policy either within a school or an organization, or even, as it refers to in the name, an institution. And so the decision maker here is usually the person who's in charge, whether that's the board of directors or the CEO or the owner or the manager. Whoever has that decision-making power is the person who can help implement these different policies. So an example of an institutional policy would be requiring beverage server training within an individual establishment. So the state policy could be something, but that manager says, I want all of my servers to be trained with responsible beverage server training. Any questions in the chat that you've seen so far, Alicia, that I should be addressing? I'm trying to keep up with it.
No, I just want to flag that Bill has noted that there's a gentleman's agreement among billboard owners not to promote alcohol, tobacco, and other drugs within 1,000 feet of parks, schools, or faith-based institutions. I would call that sort of an informal institutional policy, and it's excellent that you have that. And we'd love to see that codified into law. But I think that's a really good example of ways, that you can start working with organizations or retailers or whomever to try to begin the conversation around this as you move towards some of these more public policies. So I think that's a really nice example of that.
Yeah, and again, fantastic job. It's so incredible to see just from the people engaging in the chat that you are all working on this already, and we're so excited that you're joining us here today. And back to this, to really summarize and put into context sort of these nebulous topics that are sort of floating around, we wanted to give you one really solid culminating example that will pull in everything that we've talked about so far. So here on the screen, we're looking at essentially a graph that represents the traffic fatalities. And in black, you're seeing the alcohol-related traffic fatalities. And then in blue, that blue dotted line are the non-alcoholic traffic-related fatalities. And so the first thing that I want to call out is that first black bar in the screen, all the way to the right. And in 1984, the first state passed the minimum legal drinking age policy. And this codified that anyone under the age of 21 was not allowed to purchase or possess or consume alcohol in that state. And then by 1988, we saw all 50 states pass this policy. Now, between those two black bars, just notice in that 4-year gap, we see an overall decrease in alcohol-related traffic fatalities. And then after we see all 50 states pass this policy, we see a dramatic decrease in alcohol-related fatalities. And I have a quick question. Are you all seeing my screen right now still? I just saw mine.
Yeah,
good? Okay, awesome. And we see a dramatic decrease in alcohol-related fatalities. And then, as Alicia was referring to before, in 2006, when the Stop Act was passed, and in 2004 when ICPUD was formed, we see another dramatic decrease in both non-alcohol related traffic fatalities and alcohol related traffic fatalities. And this is incredibly exciting because not only does it demonstrate the importance of passing policy to create this positive impact in the community, it also shows the importance of collaborating both on the federal level, but also ensuring that community coalitions have the resources to take action and make change within their own communities. And so this is truly a summary of everything that we just went over. And I hope that puts into context a lot of these larger topics that we've been talking about. And now to transition a little bit, we have a quick question for you all, and this is going to be a poll. So when we're thinking about you all taking action, do you know where to find the latest data or best practices, which is the first question. Then second question, if you are interested in taking action or implementing or working and educating on some of these policies or programs in your state, do you know where to find that information? And we'll give a few minutes to allow this poll to go through. And right now we're seeing for the first question, do you know where to find the latest data and best practices? About 65% of you said yes, and we're still getting numbers in, so that's switching slightly. And then the second question, do you know what policies and programs are in your state? And we have roughly a 50-50 yes, no. So regardless of what you answered, yes or no, we are really excited to share either a new resource that you may not have heard of, or hopefully a really helpful resource that will pull together everything that you're looking for in one place. So I'll pass it over to Alicia to talk a little bit about the Stop Act reports.
Thanks. And I just want to say we are moving through this because we do want to save quite a bit of time at the end for questions. So, I'm trying to keep up with the chat and the Q&A. Please keep including questions there, but we will have time at the end to chat some more about the questions that you all have. So the good news is, I'm actually encouraged to hear that nearly 2/3 of you feel like you have a good grip on where to get resources. I think that's really excellent because I think it's one of the more challenging things in our field, especially given that there are so many different places to get resources and you don't always know where to go or what's the most reliable or who you should be looking at. And I think it's a really hard thing to navigate. And so I'm really grateful that you all have some of that. And I'm happy to share with you that we've tried to take some of that guesswork out of the equation for you. So as part of the Stop Act, we produce a series of reports each and every year. So they are kind of summarized in 3.5, I will say, different reports. The first is an annual report to Congress on the sort of the broad landscape and the status of underage drinking in this country. This is going to be our 15th report to Congress that we're working on right now. When it first started, and Rob, please correct me if I'm wrong, I believe it was around 1,200 pages, and we've gotten it down to about 250. Rob, am I correct in those numbers?
1,285 to be precise.
There you go. So I'm not sure how many of you have time to read 1,285 pages worth of text, but we've worked really, really hard over the past decade to make it a bit more consumable and manageable for you and for Congress, because we do want them to read it. We think it's really important. So that's the first report that we do every single year. We also do a state performances. Oh, thank you. I forgot that I've got slides on this. Thank you. I was just chatting. Actually, I will come back to this. The State Performances and Best Practices Guide. I'm just going to keep showing you all 4 of these. And we'll talk in more detail about what each of these are. But this actually goes through what are some of the best practices and some of what Isabel just talked about for addressing the harms and the consumption and the issues that you're seeing in your community. What does the science really tell us about what we can do about these issues? And then what does the landscape look like across the country for who's actually doing those policies? And so we'll talk a little bit more about that. But it's a really, really nice document, so that allows you to understand the science behind it in a clear and concise and consumable way. We're not asking you to go read 15 peer-reviewed articles to understand this policy. We're summarizing it for you. And then again, you can see sort of where your state falls in the broader landscape of states that might have that policy. And then we also do state reports. So for every single state, we do an individualized state report, and we'll talk more about how we get those data and what's included in there, but it includes a survey that every single state fills out for us every single year. If we have any folks who do surveys on the call, we get 100% response rate every year, which is unheard of. And my only real claim to fame is it's the only project I can ever say I have 100% response rate on. And then we group those into regional reports too. So, we started this out by doing a poll of regions, and we do group all of them so that if you are within a certain region, you can see your state within the broader context. So we'll talk a little bit about each of these because they do have a lot of value that you all might be aware of. So this report to Congress, the now less than 300-page report to Congress, one of my favorite things about it is that it looks at all of the most recent national survey data on underage drinking. And so there are 3 major national surveys that look at underage drinking. The first is the National Survey on Drug Use and Health. The second is the YRBS, the Youth Risk Behavior Survey. And the third is the Monitoring the Future. They all have questions on alcohol and tobacco and other drugs. They have slightly different questions, slightly different populations. They ask their questions in slightly different ways, but they're all really useful for understanding the broader context and looking at trends in consumption. And so we pull all of those data for you. It's all in one nicely packaged chapter where you can go and say, what is the national level of consumption among 12 to 20-year-olds? We have that. We break it down by sex, and to the extent that we can, gender identity. We break it down by race and ethnicity. We try to look at different subpopulations and subgroups who might be at higher risk and present those data to you. And again, we do this every single year, so we're always updating these data to be as current as possible. We also include some of the outcome data. So we look at alcohol attributable death. We look at motor vehicle crashes and a number of other national surveys that look at alcohol attributable outcomes and include those. So again, all of these data are in one place for you at the national level. You could just go and look and see across the different surveys. We also have an entire chapter on the factors that affect underage drinking. And we've talked about some of them today. We think about, policy, we saw the ads and of course, density and all of those things. Thank you, Isabel. And we update this every year again with the latest science. And so instead of you having to say, I think there's something associating, advertising with youth, but I don't really know what it is. I see it, I hear about it from the kids in my coalition or my community. We've laid it out for you, the science, and it changes, right? And so in the past few years, we've actually been able to say that there's a causal connection between exposure to alcohol advertising and youth drinking. 10 years ago, that wasn't the case. And so we update the science every single year based on the best available research out there to provide you all with, a few paragraphs on these major factors that affect underage drinking. A big one that I think is really relevant to this group is parental drinking. We know that the more a parent drinks, the more exposure that kids have to adult drinking, the more kids drink. And so we really do describe in the science or in the report what that literature says and what that means. And that's not just true from a one-on-one standpoint. If I see my parent drinking, then I'm going to drink more. That's true. But also from a state level, the more exposure there is just within a community to adult drinking, the more underage consumption there is in that community. So it's really scaled up to a number of factors. And so all of this is laid out in that chapter on factors affecting underage drinking. We also, talk a little bit about the coordinated federal approach and what's happening at the federal level. I think that, I've been on the ground and you don't always know what our federal agencies are doing in this space. And we have a chapter that sort of summarizes it. And then we have a full appendix that details it. And so if you're ever feeling like you don't have the support from the federal partners or, there's not enough being done, sometimes it's a reassuring moment to go and look and say, wow, there are 25 pages in the appendix of just underage drinking prevention programs that are happening at the federal level or efforts. So that's there as well. And then we do a regular evaluation of the Talk They Hear You campaign, and those data and metrics are included in the report, and some case studies and some examples and some updates on where things are and where the campaign is going. So those of you, I think all of you who are campaign partners, this is a really useful tool for you as you're thinking about your own funding, as you're thinking about pursuing additional efforts under the campaign. It's a really helpful chapter for you to understand what's been going on, get some metrics that you can pull, and understand where the campaign may be going in the future. And then the state performances and best practices report. Again, this is really about, if the report to Congress lays out the problem, the state performances and best practices report lays out the solutions. And this is from an evidence-based perspective. And so what's really important here is that we are showing you all a series of policies and programs that we know have evidence behind them. Again, we're taking the guesswork out of what do we do about this? And so we go into some detail on a series of different policies, programs, and practices, and we'll show you some examples in a minute. We provide you with the science behind it and then a map of what that looks like in your state. And we do that for 27 different policies. So again, we go pretty in depth. We've looked across a number of resources that are really known to be the gold standard in terms of prevention, things like the Surgeon General's report, actually a couple different Surgeon General's reports, a big college study that was done on best practices. And then we have the ICPUD, who are a panel of experts who help us make these decisions, as well as some external researchers and other subject matter experts who help us review these policies each and every year. We have a team of legal epidemiologists who actually pull these data, who look at your state code and go in there and understand what's happening in your state and update this every year, as well as looking at the Alcohol Policy Information System, which is another really helpful resource for understanding state policy. So we pull from APIS and we pull from our own legal database to put this together and make sure it's accurate for you every year. And then I mentioned the state survey. So every year we send out a survey to an appointee that was appointed by the governor. And from there, we ask a fairly lengthy series of questions. I don't know if anyone on this call is part of that survey, of law enforcement, of the behavioral health workforce, of different programs and practices that are in place, of federally coordinated efforts that are happening at your specific state level. And we provide all those data back to the state and back to anyone who's interested in these state reports. And so again, if you're not really sure who to go to at the state level, we provide that for you. We tell you, who the main point of contact is in your state that you could be going to. If you don't know what your state strategic plan says on alcohol and underage drinking, we provide that to you. We try to provide you as much information about the state context in which alcohol is happening, the behavioral health system in which this work is being done, and then the actual programs that are being implemented at the state level, and then what local and state law enforcement are doing to help enforce the laws that are on the books around prevention. So things like compliance checks and things like that. So we provide you with all of your survey results as well. These are the 27 different policies that we include in the State Performances and Best Practices Guide. We call that the SBBP, by the way, because it gets a little lengthy to say it out loud, and we love acronyms. I won't go through all of these, but you can see the groupings of them. We focus on underage possession, underage drinking and driving, the availability of alcohol, which is increasingly, I think, important as we're seeing a lot of these policies change in light of COVID restrictions and COVID policies changing. So things like home delivery of alcohol, that I imagine would be interested from anyone in the chat to see if this is happening in your community. But things like home delivery, cocktails to go, all of that, we're keeping a close eye on all of those things. Alcohol pricing, I saw Leanne said earlier that Nebraska was potentially maybe looking at some pricing laws. There are a number of states right now focusing on some tax laws. So all of that we are tracking on a regular basis. And again, providing you with the research on why these are the best strategies and why they are going to give you the biggest bang for your buck as you're thinking about solutions to the issue in your community. And then I jumped the gun a little bit by tipping my hand on the state and regional reports, but these are really, I think, an incredibly useful tool for those of you who are on the ground and doing work. And it's not just those who are doing work at the state level, but thinking about the work that you're doing at the more local level. And so what this does, and I'll show you some examples, is it provides your specific state data from the SBBP, which is really aggregated at the national level. We then separate it out and do a state-by-state look for you so that you can pull your state. Let's say you live in Alaska. and understand exactly which of those 27 policies, what your state is doing for each and every one of those policies. Exactly what your state is doing for programming, what your behavioral health workforce looks like in your state. And so we separate that all out for you. We also do a overview of your underage consumption data for you, and including alcohol attributable deaths. So all of that is right up front, and I'll show you an example of that. And then I think we talked through these other categories that are in there for you, and we give you your entire survey as part of your state report. So everything is in there so that you can just go through and learn more about what's happening. So we actually talked a lot about who the survey, and then you can see again what the primary data is that we collect as part of the survey. So enforcement data, funds, where are funds being spent and how, what is the interagency collaboration efforts, any data on underage drinking that they have, and a little bit more. So what does this look like in practice? I'm using New York as an example. It's just an example. I don't know if I don't see New York on the list, but maybe there's someone here from New York. But you can see here, and we're making some changes to this to make it even more user-friendly, but you can see here that we are pulling past month alcohol and binge use by a number of different demographics. Hi, Skylar from New York. Hopefully this is helpful for you. And so we do the 12 to 20. Again, our focus here is underage. So we do the broad 12 to 20, and then we break it down in these 2-year increments of 12 to 24, 15 to 17, 18 to 20, and then we do show adults as well. So these are from the NISDA, the National Survey on Drug Use and Health. And we do include, again, both the number of people who reported past use, past month or binge, and then the percentage as well. If you see an asterisk, it just means that those numbers were too small for us to be able to represent here. It just means that unfortunately the data are, actually it's usually a good thing. It means that your data numbers are too small, but it does mean that we aren't able to present those. For your specific state, we show the average age of initiation. So in New York, it's almost 16. That's better than the 13 number that we were talking about earlier. So that's a good thing. And then we have specific state, again, specific state data on outcomes here. So alcohol attributable deaths for those under the age of 21 in New York, 136 per year. So again, that means that under the age of 21, every single year, 136 youth die from some alcohol attributable condition. It could be something like alcohol attributable cancer, less likely given the age. It could be a motor vehicle crash. It could be any host of things. And we can talk a little bit more about what that looks like. And then the CDC also counts the years of potential life lost as a result of alcohol attributable conditions. And so because of underage drinking, there are 7,806 years of life lost due to the underage consumption patterns in the state of New York. And then you can see here, we also include fatal crashes. And this is the 15 to 20-year-old population. This is from the National Highway Traffic Safety Administration. So the number of fatalities in New York involving somebody between the ages of 15 and 20 who have any alcohol in their system was 33. And of all the fatal crashes involving a 15 to 20-year-old driver in the state of New York, 30% of them, 30% of all fatal crashes of all fatal crashes had somebody who was drinking as part of it. I had to read that out loud. So again, every single state gets these data. Every single one. You can use these in your grant applications. I strongly encourage you to use these data in your grant applications so that you can start to show, what does this look like for my state? What are we dealing with? What are some of the problems that we're facing? And, if it's a lot of times you want to look at how does my state compare to another state, we provide some of those comparisons for you in the SBBP, but you can also say, I want to look at how I compare to New Jersey right next door. You could pull up their report and you can just do a side-by-side and look and see. And that's helpful as if you're thinking about different policies and what policies a state may have or not have, being able to do those side-by-side comparisons across states is useful. Oh, I thought we had more slides on that. I'm sorry. Okay. You can learn more and explore the Stop Act reports. I'll put the QR code back up in a second for you. Isabel just put a link to the chat in there. We are finalizing the 2023 state reports as we speak. But the 2023 report to Congress and SBBP are both posted online. I will also just say that in addition to these state reports, we produce state PowerPoints for you. So we consolidate all of this information that are in these state reports and we turn them into PowerPoints that you can just plug and play into your own presentations. We try to make it as easy as possible for you to see your own data, to have some policy examples of what we're collecting, and to have the information that's specific to your state right at your fingertips. And so once we're done updating those will also go on the website that Isabel just linked to. And you can, again, have that for any presentations that you're doing for your coalition, for your policymakers, for your health department, whoever it may be, to really understand the state context in which you are operating. So there's a QR code. So one last thing I just want to mention is, as we think about this work that we're doing, is a new initiative that ICPUD and the Stop Act have taken on this year. And that is a policy academy for implementing community level policies. We just call it the Policy Academy for ease. And we are currently in cohort 2 of the Policy Academy. Oh, yes, I will put the code back up in 1 second, Devonna. We are currently in cohort 2 of the Policy Academy, but what this is we have selected 28 coalitions across 2 different cohorts from across the country to be part of this Policy Academy. It's a year-long opportunity for coalitions, both at the local and state level, to collaborate with some of the leading experts on alcohol policy issues. And they're all working on their own specific alcohol policy that they're moving from the beginning to the end of the process. And they're learning, we are really focusing on how do you collect data to understand what policy is the best fit for you, for your community, for your needs, for your situation. How do you engage others in this work? How do you start to build your coalition out in a bigger way? And how do you start to build it out in an equitable way that's really reflective of your community, and think about some of those equity considerations all along the way? It's a great peer learning opportunity for our coalitions. We group them based on the policies that they're pursuing. So we have a number of policies looking at taxes, and so we've grouped them together. We've got an interesting movement happening right now across the country to reduce the blood alcohol level from 0.08 to 0.05 in states, and so we've grouped them together. And so it's a great chance to not only learn from national experts on both kind of community building and coalition building, but also policy, and then from your peers. And we really are seeing this as an opportunity to build the prevention workforce on the ground. Our goal, of course, is for all of these coalitions to pass policy. That would be amazing. That would be great for our communities. But we also really want our prevention workforce to feel really comfortable in the space of population level health and population level strategies to prevent and reduce underage drinking, and be really conversant in this step and in this process. And so that's our goal, is to build this capacity. And so we are working with about 80 different people across these 28 coalitions, and really trying to build that bench up a bit as we kind of continue moving. And it's exciting to see 106 of you here today who are, potentially interested in thinking about some of these broader population level approaches to prevention. We are, exploring the idea of additional cohorts. Right now, we don't have the funding to do so. If that's something that you think you would want, we have some people you could contact to express your interest in that. We would love to kind of keep building this up and encouraging more folks to be part of it. So I just wanted to at least mention that. I'm going to put the slide back up so folks can see and take their picture of QR codes. QR codes are still a little bit novel to me, so my apologies for moving too quickly on that. State reports will be available, we're hoping within less than a month. All the state reports should be up for 2023. We're just, as you might know, everything on, we want to make everything very accessible. So we're just doing some final tweaks and that will be ready. Is that the same link that was posted in the chat? So this link is direct. Yes, that's the same link as was posted in the chat. Yes. All right. Hopefully everyone got that. If not, I can go back. But again, we really want to leave time for questions. So I think, let me check the Q&A. All right, are there any data on parental attitudes regarding approval, disapproval of underage drinking? Yes, there are. There are some data on that, and we include that in the report to Congress. So we can link you directly to the report to Congress. Or if you email us, then, and this is my email right here, we can pull that text out or direct you directly to it in the report to Congress so you can find it. But yes, there are data on parental attitudes, on community norms around underage drinking. All of that does directly affect underage consumption, and it's an important consideration. So great question, and yes, either email us or look for it in the RTC. Who would we contact to let them know our coalition is interested in being part of a cohort? Okay, we will, basically, we want to encourage, Rob, do you want to take this one or do you want me to?
Which, sorry, I was looking at the talk, they hear you, message. So send me an email, and you can just send it to my email, just put my email in the chat. I will forward this up to our leadership. I serve as the associate administrator, so I'm the person that is the champion and manages all of this work for the agency and for the 23 federal agencies. So send me an email, I'll forward it up. We'll see what folks say. It's important that they know that there's interest in the policy account.
One of the earlier questions that I just want to loop back on is, how do laws around candy flavored tobacco not apply to some of the products that Isabel showed you earlier? It's a really great question, and there are a number of different answers. I would say the most sort of concrete and direct answer is that the Master Settlement Agreement of the early 1990s really changed the way that we regulate tobacco products. We were able to have a better understanding of the intent behind those products as a result of the papers that came out as part of that settlement. And it completely changed America's relationship with tobacco and the way that it's regulated. There has been no similar agreement or settlement or lawsuit or action around alcohol. And so it's just regulated in a very, very different way. It's been interesting, I'll just say, seeing the rollout of non-medical adult cannabis use, because you're starting to see regulation in a bit of a more concrete way around packaging for cannabis than we've seen historically for alcohol. And so I think that the cannabis regulators have caught on to some of this, with trying to remove some of the products that are cartoon that look just like, candy, and you wouldn't know that it has THC in it or cannabis. And so we are seeing some of that movement around cannabis regulation, but it's a really challenging thing to do for alcohol, and we just don't have the same historical litigation tactics that have allowed it for tobacco. In your presentation, you mentioned that male drinking was higher than female drinking. So this is changing. Yes, our data is indicating that past 4-year female 30-day consumption is exceeding males. This is absolutely the case. We are seeing this convergence of consumption. I have a whole presentation on this that I would love to do anytime if anyone's ever interested in. It's one of my favorite topics in a really depressing way, is the increase in consumption among women and girls. But we are seeing, historically, what we've seen is this kind of consistent downward trend of both males and females going like this. And what we're seeing is they're both still going down, but female alcohol use has stopped going down, or is going down much slower than male alcohol use. And so they're starting to converge. Those two trend lines are actually starting to converge and cross in some cases, and in some age groups. And that's actually true across every single age group. The data are really showing that while both are decreasing, women are decreasing at a rate slower than men. And so they're actually drinking more in a lot of instances. And I think this is the first time that we've seen that college drinking is higher among females than males. So we are seeing that, and there's a whole section in the report to Congress on this exact issue. So we are definitely seeing this change in pattern among consumption. And I think that there's a lot of different reasons out there for why, and we could spend, again, I could literally spend 90 minutes talking about that. But it's a real concern. I think it's something that we really need to be looking out for. And I'm glad to see that your community data are showing that, because I think, we see it at the national level, but we don't have as much data at the local or state level. And so it's interesting to me. I'm curious too, if you don't mind, Pat and Laura, just putting in the chat where you're from, what state you're from. But that is absolutely a trend that we're seeing. And again, there's a whole write-up about it in the report to Congress. So you can see it in there as we talk about this convergence and how it's happening among youth and among older adults too. I mean, it's truly across the lifespan, and at different rates. But yes, that's absolutely a trend that we're seeing. Ohio and New Jersey. Interesting. That's interesting. Okay, you mentioned alcohol education being ineffective in isolation. Can you provide a link to research about this topic? Yeah, there's definitely some research out there. And I think my go-to resource on this, and Rob and others, please jump in, is actually the Surgeon General's report on alcohol, drugs, and health that came out in 2016 does a really nice setup for this in chapter 3, the prevention chapter. They talk about the need for a multifaceted, multi-level approach to prevention. And that the most effective thing that you can do is try to hit all levels of the continuum, from individuals all the way through communities. And that's how we know we're affecting the most people, that we're having the greatest impact. And again, we know that policies, the science is very clear that policies really do have the greatest impact, right? You are affecting everybody in a community or a state or a country through these policies. And the science is really clear on the strength of that. And part of the issue with alcohol education is that it's a much smaller dose. It's a more direct contact. And so you don't have the same impact at a broad scale. And then again, it tends to, the information that folks learn from their education doesn't tend to have long-lasting effects. So you might see improvements in knowledge and confidence or skills over a 3 to 6 month period, but typically those effects start to wane after 6 months in terms of the information that they learned as part of that education. So I would strongly encourage going to the Surgeon General's report. It's called Facing Addiction in America. Again, that's chapter 3, and it sets it up pretty well in that first page there to help explain that. But I wouldn't say don't do alcohol education. I would just say don't do it in isolation. Do it in conjunction with other evidence-based programs, practices, and strategies that we outline in the SBBP and other places, to just make sure that what you're doing is really providing a comprehensive approach to prevention in your community.
Let me chime in here for just a minute, because I also saw a question about the efficacy of Talk They Hear You. It is one of the reasons that in our conversations, I've managed this process for 13 of the 15 reports to Congress. So I've been at this a minute. And our campaign, which the Talk They Hear You campaign, is a product of the ICPA. We don't always advertise it that way. That's a little bit intentional, just to help you guys with marketing purposes. But to Alicia's point and to the person's question, one of the things that really about 4 years ago, almost 5 years now, we started aligning our public health messaging with interventions. And part of that rationale really was based on the science that Alicia just talked about, that just education alone in and of itself has a limited shelf life. And if it doesn't have a longer, what I often will say is, don't have the one big conversation, have the 61-minute conversations. What I'm really saying there is, over the course of a lifetime, this is an active conversation repeatedly. So think of the brief intervention from an adult side, meaning parent, caregiver, adult in the communities having a conversation around harms, etc. But then there are other brief interventions along the way. That could be a classroom, something like Gil Bachman's life skills, any number of others, that Project Alert. There's a whole list of EBPs. But it also can be raising awareness at a school level. Now, I don't mean doing the big assemblies. There's some evidence around that not being all that great too. Those are sort of one-shot wonders. You have to be consistent with that. And that really has been the build out of the Talk They Hear You campaign. You will see that we've got a number of interventions, parent night out, a number of things that are designed specifically, including the mobile app, other tools and resources to help you in that space. But I also wanted to answer the question of efficacy, because people ask this question all the time. First of all, there's an entire chapter 5 in the report of Congress that's dedicated to the annual evaluation of Talk They Hear You since its inception. That means its initial development all the way through to the 2023 report, which would be the 2022 activities of Talk They Hear You. But I also want to help you when somebody either in your state or other says, well, that's not an evidence-based program. What I would say to that is, first of all, it's authorized by Congress and it's authorized by SAMHSA. End of statement, full stop. No requirement. Congress has asked me to have it evaluated. It is an authorized activity, bar none. Now, that said, I could point to any other national campaign And there are very few that have actually been evaluated, and very few that have the level of evaluation that we've had consistently. And that is by design, which, you know, Chelsea and the Talk They Hear You team, our evaluator and others work diligently to get these materials evaluated and to make sure that we're doing good work. If there's ever a question about that you're having, please feel free to email. I'd be happy to clear that up for anybody who's saying you can't use the campaign, because you both assuredly can. First of all, Congress appropriated money, and Congress expects you to use the money. Otherwise, why would they appropriate? There's really no reason to do that. Just let me know should you have comments and questions on that. We are also, you know, it's worth saying to this group, every product since the inception of this campaign has been built by and for you. Meaning somebody in the community has requested a product line or said we have a need or a gap. And is there a resource or tool that you can either develop or that we can use to satisfy that issue? Now, we don't have everything in every place with any products coming. But that said, just to give you a sort of an idea of that, and as the 2024 report to Congress is being developed, even as we speak, you'll see more information along that line, including pilot studies on Screen for Success and some of the other tools as well. Alicia, back to you. Sorry.
Thanks, Rob. Appreciate that. We still have a little bit of time. So any other questions from anyone? I know we moved kind of fast. So the question came up again about, oh, okay, good. Maybe we only have an hour. Okay. Any last thoughts on the efficacy of the TTHY campaign? I would just say, Devonna, do look at chapter 5 of the report to Congress, and that is where we provide that evaluation and the metrics for you. So it's a really helpful chapter to understand what's been evaluated, how it's been evaluated, what the data show around it. And we're continuing to sort of evolve and you know, and evaluate more and more of the campaign as we move forward. So that chapter will continue to be updated and revised. So chapter 5 is really going to be your best bet to understand the efficacy of TTHY. Yeah, I saw the question about products like alcoholic soda and juice being okay to produce with candy. That's really about that master settlement agreement. That was what I was talking about there, is the tobacco master settlement agreement changed the way that we regulate tobacco. And that hasn't happened yet with alcohol. So it's really about the entities that regulate alcohol, how they're regulated, and no, it's okay. And you know, there's a big, the alcohol industry is a multi-billion-dollar industry. And so they're going to continue to evolve and come up with new products. And it's hard to stay on top of them, truly, and I think regulate them. So I think that's part of the issue as well. Okay, I'm sorry, this is supposed to end at 3, and I just kept chatting. So thank you all, and let me actually turn it back over to Scott for any final thoughts.
Great, thank you so much, Alicia and Isabel, for all that terrific information. And if you could advance the slide, there's one more slide I wanted to talk about. There it is. So to everyone that participated, again, thank you so much for doing that. On the screen, you see the email. If you have any questions that you had that we didn't get a chance to answer today, feel free to email and send them to us and we will get them answered. And if there's anything else that you have questions about, you can email us as well. And there's also some links there for SAMHSA. You can follow SAMHSA on social media, and we're always putting out a lot of good information there as well. And then lastly, just want to let everyone know that to be on the lookout for Talk to Hear You Facebook group. It's going to be coming out. The link for that group will be coming out very soon. So we encourage everybody, once you get that link, to join that group, and we'll have more information about that as well. And then lastly, we have our community engagement meeting survey. Again, just use your iPhone to click on that QR code, fill out the survey, let us know how we're doing and how things that we might be able to do in the future better. We'll keep this up for just a little bit. But again, on behalf of the Talk to Hear You team and on behalf of SAMHSA, I want to say thank you so much for participating, and I hope everybody has a great rest of your week. So thank you.